Good morning, one and all. Today's topic for discussion is caries prevention. There are various treatment methods which are designed to limit the tooth remineralization caused by cariogenic bacteria and preventing the initial lesions and progression of initial lesions into the cavitated lesions. There are various preventive methods that include which limits the growth of pathogenic bacteria and modifies the metabolism of the biofilm, increases the pH of the biofilm. It also increases the resistance of the tooth surface to demineralization. So, these are the various methods which enhances the prevention of caries that majorly helps in preventing the newly formation of the caries and also the progression of the existing caries. So, the goals of the prevention are more or less similar to that of preventive methods, that is to modulate the biofilm into a non-pathogenic biofilm to create an environment conducive to remineralization. This is the tabular column which will explain us the medical model of caries management. It includes 7 different steps. Those were limit cariogenic substrate, modify microflora, disorganize plaque biofilm, modify the tooth surface, stimulate the salivary flow, seal the susceptible surfaces and restore the active cavitated lesions. In short, the medical model of caries treatment includes reduction in cariogenic bacteria. It includes preventive measures, remineralization of the early enamel lesions, minimum surgical intervention of cavitated lesions, repair of defective restorations. Let us know in detail of all these steps of medical model of caries treatment in coming up slides, where we will be discussing about various factors that influence the caries prevention. So, here comes the factors. Those were the overall health of the patients, the diet that they consume and oral hygiene practices, the fluoride exposure, whether it be systemic, topical or various varnishes or fluoride rinses. It also includes the silver, diamine, fluoride and various immunization methods. Saliva has a role in caries prevention. Chemical agents, calcium phosphate compounds like CPP, ACP and pit and fissure sealants or resin infiltrants are used for initial caries prevention. So, we will be learning in detail about the individual factor that has a role on caries prevention. Here comes the general health of the person. The patient's general health has a significant impact on overall caries risk. Decreased salivary flow is commonly seen in elderly patients or compromised patients or systematically ill patients. In those patients, we have to examine the plaque index, salivary analysis, examination of the oral mucosa, gingiva and teeth has to be regularly done for the diagnosis of the caries in the earlier state and thereby preventing them for the further progression. And in also the acute and chronic systematic illness patients also, there will be a dramatic increase in the formation of the biofilm because of their lack of dexterity in practicing the oral hygiene practices also might be the reason for increased biofilm formation in them. So, with the improvement of the overall general health, thereby also improves the oral health of the patient, thereby we can also help, that also helps in preventing the formation of the new carious lesions. So, here comes the next factor, that is the diet. We all know the diet plays a very important role in the formation of the caries. The more we take the sucrose containing food materials, more the number of times we consume the sucrose, the more the availability of sucrose to the cariogenic bacteria that is present in the biofilm, thereby undergoing the metabolism as a result, the acids are produced on the tooth surface, leading to the demineralization. So, the dietary sucrose has a detrimental effects on the biofilm, thereby which affects the caries formation. How does it affect? It affects by change in the biofilm profile from a non-cariogenic biofilm to the cariogenic biofilm. It also affects the mature biofilm because continuous frequent exposure of sucrose metabolizes into an organic acid, thereby resulting in the prolonged decline in the pH. Whenever there is a decrease in acid, whenever there is an acidic pH, that leads to the demineralization of tooth surface, thereby forming a cavity. Because remineralization and demineralization is a dynamic process, whenever there is a drop in pH, the tooth tend to demineralize. So, these are the two detrimental effects of sucrose on the tooth surface. So, one has to focus on the type of cariogenic foods we consume and the number of times we are consuming, that is the frequency or the length of exposure of these cariogenic episodes is very, very important. So, here the role of dentin is to give a dietary counseling to the patient in order to take more the fibrous food, less of sucrose containing foods, and taking more of sugar free foods, altering the some of the other alternative to the sugar substitutes can also be advised to the patients. With this dietary counseling, we can always prevent the caries formation, or also can be prevented the progression of the caries lesions. So, here comes the next factor, that is the oral hygiene. We all know the oral hygiene practices will help in removing the plaque that is formed on the tooth surface, thereby reducing the bacterial biofilm on the tooth substrate. So, as the tooth surface are free from biofilm, then there won't be any decay. This removal of biofilm, usually done by dental flossing or tooth brushing with a fluoridated toothpaste, is the best patient based measure which can be advised to the patient for preventing caries and the periodontal disease as well. So, even for the children, effective diet counseling and oral hygiene practices will help in preventing the caries. The next factor that influences the caries prevention is fluoride exposure. We all will be learning in different aspects of the fluoride. Whenever we hear about caries, we will definitely listen to the term fluoride, because fluoride is very, very essential for preventing the caries. The trace amounts will increase the resistance of the tooth structure to demineralization, thereby the prevention of the caries. The fluoride can be taken in various forms, either it is a systemic fluoride, systemically or topically, or fluoride rinses or fluoride varnishes. It can be taken through the diet or toothpaste, mouth rinses, or professional topical applications of fluoride. Let us know how this fluoride has anti-caries effect. It acts by three mechanisms. The first and foremost one is this fluoride will causes the precipitation of the calcium on phosphate that is present in the presence of the fluoride. The calcium on phosphate ions present in the saliva tend to get precipitate on the tooth surface, thereby forming the fluorapatite. This fluorapatite is a resistance to acid, because this calcium on phosphate occupies the space which has been removed during the demineralization by manganese and carbonate, thereby making the tooth surface resistance to acid attack. The same mechanism can also be used for the remineralization of the initial lesions, and the fluoride also has an antibacterial activity. By these three mechanism, the fluoride has anti-caries effect. That is how it is very, very important for the prevention of the caries. It will be given in various modalities. Here is the tabular column which shows the topical application or systemic intake of fluoride. It is being given as a method of delivery, and the amount of fluoride we have to take in parts per million, and the amount of caries reduction can be seen in this tabular column. So, here comes the one of the factor or the fluoride modality which has an effect on the caries prevention, that is silver diamine fluoride, which is gaining popularity in recent times, though it has its own drawbacks, that it stains the tooth surface. This topical application of silver diamine fluoride acts as a caries arresting agent. It has antibacterial action and slows the demineralization and enhances the remineralization. The silver and fluoride present in the silver diamine fluoride has antibacterial action, so helps in slowing the demineralization and by promoting the remineralization. What is the advantage of this silver diamine fluoride or SDF is ease of application, and it is recommended for the large cavitated lesions, so that we can conserve the tooth structure and instead of further mechanical preparation of the cavity. What are the drawbacks of this silver diamond? As I told you earlier, it stains the tooth surface because of the presence of the silver. How do you apply this SDF is with a micro brush for 3 minutes on the after removal of the caries, apply this SDF on the tooth surface and then cover it with a varnish, or then you can also rinse it with water. The anti-caries effect of SDF lasts for 1 year, that is what the researcher says. So, we have to monitor the caries progression after 1 year. So, we have to call the patients for recall appointments on a regular basis. These were certain drawbacks because it is not a permanent solution for caries prevention. For time being, to conserve the tooth structure, we can use this silver diamine fluoride. So, here is the picture that is showing the SDF treatment. The first picture shows the caries tooth, that is 1/7. The second picture after excavation of the caries. The third one is application of the silver diamine fluoride, which is brown in color. Leave it like that. The fourth picture here, there is a caries showing underneath the crown, where is inaccessible for the cavity preparation or application of restorative material. So, what one can do is apply the silver diamine fluoride, so it can arrest the caries progression. Then comes the immunization. There are various researches that have taken place against the cariogenic bacteria to prevent the caries in human beings, but none of had a greater effect. So, these vaccinations have maybe no more effective than fluoride therapy, which has a proven safety record. So, among all the preventive measures, I think fluoride has a greater effect compared to that of this immunization. Even this probiotics, this is one topic that has been given in the textbooks advance. They say that inoculate the floral cavity with bacteria which competes with that of cariogenic bacteria and eventually replace them. So, what they will do, they will inoculate a certain kind of bacteria which compete with the cariogenic bacteria for the substrate. So, here the substrate is the tooth. This bacteria will compete with cariogenic. So, the cariogenic bacteria does not have any substrate to form a biofilm and thereby thrive on the sugars that we intake, they further forming the acids and demineralization. So, this entire cycle has been restricted by competing with other bacteria, but again this probiotics does not gain much interest among the clinicians. So, here comes the saliva. We all know the saliva plays a very important role. It has its own advantages in preventing the caries because it dilutes the acid that is produced in the biofilm. The bacteria, the organic acid that has been liberated in the biofilm after metabolism of sucrose. This gets diluted because of the saliva. It also washes away the acid. It has the buffering capacity by forming the bicarbonates. This saliva also helps in remineralization because the saliva contains the calcium and phosphates. Whenever in the presence of fluoride, this calcium and phosphate gets deposited on the tooth surface, thereby forming the acid resistant tooth surface. This in turn affects the prevention of the caries. The saliva also helps in the formation of the pellicle formation, thereby protecting the tooth surface. So, these are the 5 different ways of preventing the caries by saliva. What will happen if the salivary flow is not proper? Usually in the elderly patients, they will have a low salivary rate and decreased buffering capacity because the uses of various medications for systemic conditions. So, thereby to improve this salivary rate, one can use less xerogenic drug that can be used. Salivary stimulants like pilocarpine and cevimeline can also be used. Increased water intake, use of sugar free chewing gums or xylitol chewing gums can be encouraged. So, after understanding the role of saliva in preventing the caries, in order to improve the salivary flow and buffering capacity, we can use these various methods for the elderly patients or immunosystemic health impaired patients to improve their salivary flow, thereby preventing the caries. Here comes the chemical agents. There are various chemical agents that can be used to modify the bacteria in the biofilm, thereby preventing the caries. Some of them are chlorhexidine and xylitol. Chlorhexidine, we all know it has bactericidal and bacteriostatic action when used in the form of mouthwash, varnishes, or along with your fluoridated toothpaste. It mainly prevents the adherence of the bacteria to the tooth surface. And we can also use xylitol chewing gums, 2 xylitol chewing gums after meals or snacks for 3 to 6 minutes will helps in reducing the caries rate and enhances the remineralization. Other chemical agents which act by killing the gram-positive karyogenic bacteria are propolis, licorice root, arginine, and sodium hypochlorite of 0.2%. Oral rinse can also be used. These are the various chemical agents: chlorhexidine, xylitol, and propolis, arginine, licorice root, sodium hypochlorite. These are the various chemical agents which modifies the biofilm, thereby preventing the caries. This is the tabular column which shows the various antimicrobial agents. Either it could be of antibiotics or bisguanides or halogens. Antibiotics includes vancomycin, kanamycin, and azithromycin. Bisguanides includes chlorhexidine, alexidine. Halogens includes fluoride and iodine. Just now we know the understanding its mechanism of action in preventing the caries. Then comes our calcium phosphate compounds, which is very helpful in preventing the caries. Amorphous calcium phosphate has a potential to remineralize the tooth structure because this ACP releases the calcium and phosphate ions into the saliva and then increases, supersaturates the calcium phosphate ions onto the tooth surface, and it also supersaturate on the tooth surface. This calcium and phosphate ions released from amorphous calcium phosphate is stabilized by casein phosphopeptide, which is nothing but milk proteins. This casein phosphopeptide and amorphous calcium phosphate together is available in the toothpaste form, that is GC company is made it available in a toothpaste, that is MI paste or GC MI paste plus, along with the fluoride. It helps in preventing the caries by keeping the calcium and phosphate ion supersaturated on the tooth surface and making the tooth surface more resistant to demineralization. This can be taken in the form of gums, lozenges, and typically applied topically, also applied through your dentrifices. This is the role of calcium phosphate compounds in preventing the caries. Here comes the sealants. This we commonly call it pit and fissure sealants, which we use resin material. This has a preventive effects. Majorly it has 3 ways of preventing caries and pit and fissures, because these resin materials will mechanically fill the deep pit and fissures, which is not possible to cleanse thoroughly with regular oral hygiene practices, and also physically limits its surface for the bacteria to reach, and also thereby making the surface self cleansable area. By these 3 mechanisms, these pit and fissure sealants will prevent the caries in posterior teeth. The low viscosity resin sealants, which is used as an infiltrant for treating white spot lesions, can also be used for preventing the caries. These were called as resin infiltrates or preventive resin infiltration. This is one gaining popularity nowadays in very non-invasive method in treating the initial enamel caries or white spot caries lesions in the anterior teeth. So, this is the final tabular column where the caries component, what is the intervention method that is used for preventing the caries. If you take it as a saliva, you can use the chewing gums. Xylitol chewing gums are advisable, CPP, ACP, because it maintains the calcium phosphate ions supersaturations in the saliva. If it is a tooth, we can always use fluoride, systemic intake of fluoride or topical application of fluoride varnishes can also be used, or for posterior teeth we can use pit and fissure sealants. For anterior teeth we can use infiltrants, or lasers has also been applied. Certain lasers when applied onto the surface, on the R tissue lasers when applied onto the tooth surface, which that makes the tooth surface more resistant to acid, thereby preventing the caries. If you take the diet component, we can address this by dietary counseling and advising to take the protective foods like fibrous foods like fruits and vegetables rather than taking more of sucrose containing foods. Bacteria, the bacterial biofilm can be modified by various antibacterial therapy like chemical agents, antibiotics or chlorhexidine, xylitol and sodium hypochlorite can be used in modifying the biofilm or altering the metabolism, and also by chewing gums, as we know, as we learnt just now about xylitol, because this xylitol is resistance to mutant streptococci metabolism. As it is resistance, there is no production of acids and thereby preventing the caries. So, this tabular column cut shorts the typical caries component and its intervention method. So, for better understanding of the entire topic of caries prevention. So, here comes this slide. With this slide, I will conclude this topic, caries prevention. This is very important in the history of how we have moved from extension for prevention, which was proposed by G.V. Black in 1891, to the current state where prevention for extension is advised. So, if you see these three pictures, in the first picture we will usually extend the cavity outline in order to prevent further formation of the caries. Usually that happens in the caries G.V. Black's cavity preparation. In the center picture shows in 1991 minimal invasive dentistry, rather than preparing the extensive cavities, we can prevent the progression of the caries when they are at the earliest stage by filling with preventive resin materials, or by using the remineralization methods. So, in the current state, that is the last picture, even before the formation of the caries, we are using many remineralization materials and making the tooth surface more resistant to demineralization by application of calcium phosphate and fluoride. So, this is how it's been moved from 1891 to current state, that is extension for prevention to prevention for extension. So, I hereby conclude the topic caries prevention. Hope you all understood it well. You can refer Student's 7th edition textbook for any further clarification. Thank you.